लॉकडाउन में न्यूरोएनाटमी सोचा शुरू करेंगे हम, पर जब हमको कुछ समझा नहीं सोचा शुरू करेंगे एब्डोमेन। न सीखा हमने पेरिटोनियम फिर भी पेरिटोनियम रिलेशंस याद रखेंगे हम, फिर सीखेंगे हम पेरिटोनियम इन अ क्लासरूम लेक्चर, फिर सब रिवाइज करेंगे हम। Hello students, welcome to the first lecture on the series in gross anatomy of the abdominal organs, and today we're going to be studying about spleen. Now, before we get into details, this is the proforma of how we describe any abdominal organ. We first start with a short and sweet introduction, then we speak a little bit about the functions of that organ, then we talk about the location. Now here we usually try to understand which quadrant it lies in, so for that you'll have to refer to a previous lecture, Introduction to the Abdomen, where I speak about the abdominal quadrants and how they are divided into 9 regions. And then we also speak about the extent, and for that we usually use vertebral levels, ribs, etc., etc. Then we speak about the morphology of an organ, and we discuss that in terms of shape, color, texture, size and dimensions, weight, capacity if it's a hollow organ. Then we speak about the external features. Then, if required, the internal features. Then we speak about the relations. In that we have the visceral relations, where we describe all the other abdominal organs and how they are related to this one, and the peritoneal relations, which are essentially folds of the peritoneum or sacs or recesses of the peritoneum that they are related to. Now, peritoneum will be considered in a separate lecture. So for now, like I sang in the song, you just need to mug them up, and eventually we'll find out more as our concepts start getting clear. Then vascularization, that is blood supply, venous drainage, lymphatic drainage, as well as innervation. The microanatomy or the histology and the development or the embryology will not be discussed in these lectures. That will be a separate series, and we'll speak a little bit about the clinical anatomy. So let's start with a short and sweet introduction. In Greek it's called spleen, and in Latin it's called lien. It is the largest hemolymphoid organ in the body. It has a very important role in blood-borne infections. It is commonly known as the graveyard of the RBCs, because the red blood cells, once they start getting old and aged, are eventually stuck into the spleen and they are phagocytosed. So spleen is famous for its capillaries, the splenic capillaries, and we'll study more of that in histology. What are ellipsoids, what are stave cells, and also the splenic macrophages, which are extremely efficient in killing the old RBCs and then recycling the heme part, the porphyrins, etc. All these things, if do not occur smoothly, can lead to a wide range of clinical manifestations, most of which present with a clinical sign known as splenomegaly. Open and closed circulation, another interesting concept. Now you have already studied the vascular system in histology, right? So closed circulation is the typical arterial capillary venule system, and in open circulation the blood actually pours out through what are known as sinusoidal capillaries, and the entire surrounding tissue is bathing in that blood. Now there are certain regions in the body where this kind of circulation is seen, and spleen is one of them, although there is slight controversy about whether human beings have open circulation, closed circulation, or a bit of both. Another role is storage of RBCs, which is not seen in human beings, but it is seen in animals with high intravascular volumes, such as the horse. The functions: erythropoiesis, or the production of red blood cells in fetal life; lymphopoiesis, basically production of lymphatic tissue such as macrophages, plasma cells in adult life; phagocytosis of worn out and old RBCs, as we mentioned before; and RBC storage, which is primarily more seen in lower animals, but it's controversial whether it's seen in humans or not. Location on extent, it is present in the left hypochondrium, this region between the 9th, 10th and the 11th left ribs. It is sandwiched between the stomach and the diaphragm posteriorly. It is present behind the left mid-axillary line, that's your mid-axillary line of the left side. And the long axis is parallel to, now you can't see it from here because the spleen lies posteriorly, but it is parallel to the 10th rib. Okay? Morphology, it is a wedge-shaped organ. Some other variants include tetrahedral 42% and sometimes, very rarely, triangular in shape, which is 14%. The color is purple. The size is that of a human fist, and the measurements are: the thickness is 1 inch, the breadth is 3 inches, the length is 5 inches, and the weight is about 7 pounds. And this can very well be remembered by what is known as the Harris dictum of odd numbers: 1 inch thick, 3 inch broad, 5 inch long, 7 pounds heavy, and 9 to 11. That's between the 9th to 11th ribs. Now this, what you're looking at, is the inner aspect of the visceral surface of the spleen. You can see over here the superior border. Sometimes there's 2 or 3 characteristic notches which are known as the splenic notches that are present at the superior border along the anterior aspect. You have the inferior border here, the intermediate border over here. This is the hilar region of the hilum from where vessels are entering and leaving, right? And this part is known as the anterior end, which is more like a border. Now this is known as the anterobasal angle. Okay, it lies on the upper part of the anterior end, and this is known as the posterobasal angle. It lies at the junction of the inferior border with the anterior end. Remember that the anterobasal angle is also known as the clinical angle of the spleen, because it is this part that starts enlarging first during splenomegaly. External features, like I said before, the organ has 2 ends, the anterior end and the posterior end. The posterior end is more rounded while the anterior end is more like a border. It has 3 borders: superior, intermediate and inferior. It has 2 surfaces, this entire visceral surface and this surface that is known as the diaphragmatic surface. And it has 2 angles: the anterobasal angle, which is junction of the superior border and the anterior end, and the posterobasal angle, which is the junction of the inferior border and the anterior end. The visceral surface is further divided into these subdivisions, which we shall study further, and you can see the vessels entering into the hilum. Let's now go to the 3D lab and see what exactly the spleen looks like and what is its morphological features. Hello students, welcome to the 3D lab, and let's see what we have here. So this is the anatomical position, and you can see the abdominal organs. You can also see the heart here. I'm going to zoom out a little bit. So if you observe carefully, that guy over there, that's the spleen, and you can already see that the anterior end of the spleen is facing more laterally and forwards, and as you go behind, its posterior end is facing backwards and medially. Okay, so that's an important thing that students always get confused with. Whenever they are asked to hold the spleen, they always assume that it is held somewhere on the anterior aspect of the ribs. It is supposed to be held somewhere along the posterior aspect of the ribs. Okay, let's have a look from the top. So if you see from the top, you will see that the spleen is actually present behind in the posterior half, if you take a coronal section, right? So please remember that. Now moving on, first let's isolate it and then we'll see its relations. So I'm going to isolate it now. There we go. Let's zoom in. There you go. Digital splenomegaly. Let's call this digital splenomegaly. Okay. Now, this is the anatomical position. Okay. Something like this. Now let's talk about the morphology. External features: the spleen presents with two ends, the anterior end which you are facing and the posterior end which is behind over there. Okay, as I said before, the anterior end is facing downwards, forwards and to the left side, while the posterior end is facing upwards, backwards and medially towards the vertebral column. The anterior end is related to the left colic flexure, which we shall see soon, and the posterior end is related to the upper pole of the left kidney. Remember that, okay? Let's look at the borders. The superior border, the inferior border, and somewhere along the intermediate border. Okay, it's not very conspicuous here, but at a different angle I'm sure we'll be able to appreciate it better. Now if you see, at the anterior end of the superior border you have characteristic notches which are known as the splenic notches, and that is how you can hold it in the anatomical position. Make sure that the splenic notches are facing upwards and the anterior pole is facing laterally and forwards. Okay, now let's speak a little bit about the surfaces. So what you're looking at right now is the visceral surface, and it further shows the following impressions. Between the superior and the intermediate border you have what is known as the gastric impression, which is related to the stomach. Between the intermediate and the inferior border you have the renal impression, that is related to the upper pole of the left kidney, and the triangular area that you see anteriorly is known as the colic impression, that is related to the colon. To be more precise, it is related to the part of the colon where the transverse colon meets the descending colon. This is known as the splenic flexure of the colon. Okay. Now somewhere in between over here is the hilum of the spleen, from where the structures enter and leave. And in between the hilum and the colic impression you have a little bit of area that is essentially related to the tail of the pancreas. Okay. Now let's have a look at the other surface, that is the diaphragmatic surface. Okay, so the diaphragmatic surface looks something like this, and it is essentially going to be related to the diaphragm as the name suggests, and just outside of the diaphragm you will be having the left costodiaphragmatic recess, then the left lung, the lowermost part of the left lung, and finally the 9th, 10th and 11th ribs along with the intercostal spaces. Okay, now let's have a look at the visceral relations, and the peritoneal relations unfortunately we can't really discuss on the app because they don't really show it as well. So firstly, you already know the relations because of the names of these impressions, right? So the gastric impression is related to the stomach, the renal to the kidney, the pancreatic to the tail of the pancreas, and the colic to the colon. Let's have a closer look at these things now. Here we go. That's the relations of the visceral surface. That's the stomach, right? That's the splenic flexure. That's the tail of the pancreas. And if you want to have the look at the kidney, then we'll have to look at it from behind. So I'll have to just add the kidneys though. There you go. That's the part of the kidney that is going to be related to the spleen. Okay. Relations of the diaphragmatic surface. As the name suggests, it is related to the diaphragm. In fact, it is sandwiched between the diaphragm posteriorly and the stomach anteriorly, as you can see here. Okay. So let's just quickly see what else is it related to other than the diaphragm. So I'm going to add the skeleton here so you can get a basic idea how it is related to the 9th, 10th and the 11th rib. And in between the diaphragm and the 9th, 10th and the 11th rib, let's see what we have. Oh, we have the, I don't know if you remember this, but we have the left costodiaphragmatic recess of the pleura. Can you see that? There we go. And slight part of the left lung. Okay, so posterior relations, diaphragm, left costodiaphragmatic pleura, lower aspect of the left lung, and 9th, 10th, 11th ribs along with the intercostal spaces. Great. Now that we know the morphology, let's speak a little bit about the relations. So in the visceral relations, you have the stomach fundus, the upper and anterior aspect of the left kidney, the left colic flexure, also known as the splenic flexure, and the tail of pancreas. You've already seen that in the video. Let's speak a little bit about the peritoneal relations. For now, I just want you to remember that the peritoneum is going to present itself in these regions as double folds, which are going to be reflecting off the organs. Okay, so we have two peritoneal folds with relation to the spleen. These are the gastrosplenic ligament and the linorenal ligament. Let's have a look at the diagram here. You can see that the stomach is completely removed. The transverse colon is cut, so you have your splenic flexure here. Okay, now there is a part of peritoneum that connects the splenic flexure to the diaphragm, and this is known as the phrenicocholic ligament. It's not technically a relation of the spleen, but you can see how the anterior end of the spleen rests on this structure. So it actually lies at the undersurface of the anterior end and supports it. Okay. Then you can see over here the tail of the pancreas. This is the left cupola of the diaphragm. This is the central tendon of the diaphragm, and the spleen has basically been made lighter and faded, so you can see the posterior relations carefully. You can see over here the upper pole of the left kidney with the suprarenal gland of the left side. Okay. Now here you can very nicely understand the splenorenal ligament, also known as the linorenal ligament. As the name suggests, it connects the spleen to the left kidney. Now can you see the left kidney over here? It's covered by this peritoneum, and it's coming over here and reflecting off this region, right? And from here, from the diaphragm, you can see something reflecting off over here. So this cut part is actually the cut double fold of the linorenal ligament. Okay. Next diagram. Here you can see the other ligament that the spleen is related to, and it is somewhere associated to the anterior border of the spleen, and this is known as the gastrosplenic ligament. Again, can you see a double fold? See, one fold here, one fold here. This is a double fold that is reflecting off the anterior border of the spleen and then going to join the fundus of the stomach, which is supposed to be lying over here. Okay. This is the peritoneal reflection at the splenic hilum. Not the anterior border, slightly a little more medial to it where the hilum is. Now please note that it is through the linorenal ligament that the structures that enter the spleen get inside. So the double fold inside it carries the splenic artery, the splenic vein, as well as the tail of the pancreas and nerves and lymphatics. Vascularization and innervation. The arterial supply is by the splenic artery. It is a characteristically tortuous artery, which is a branch of the celiac trunk, the artery of the foregut, which you can see here. And the tortuosity helps in instances when the stomach is being distended. So you need to have a certain amount of flexibility here, right? The venous drainage is by the splenic vein, which lies just inferior, and we'll have to remove the pancreas to see the splenic vein. Lymphatic drainage. Now surprisingly, the spleen does not really have a lot of lymphatics because most of the fluid of the spleen is directly drained via the splenic sinusoids into the splenic veins. However, the external capsule of the spleen and the extensions of the capsule in the substance of the spleen known as trabeculae do have certain lymphatics, and their lymph is carried by lymph vessels which travel along the linorenal ligament. Okay. The innervation is by the celiac plexus, and it is sympathetic fibers which are vasomotor and also lead to contraction of the smooth muscle that is seen in the splenic capsule. Now again, there's a lot of controversy here. It's not very sure if there is a lot of smooth muscles in the splenic capsule of humans, but in animals like the horses, there is smooth muscles, and yes, there are times when this smooth muscle contracts and leads to expulsion of the blood when needed. Also, please note that the splenic vein is joined by certain tributaries known as the short gastric veins, the left gastroepiploic vein, the pancreatic vein, as well as the inferior mesenteric vein, which we shall study in subsequent organs. Let's now go back to the 3D lab and see the vascularization of the spleen. Okay, just to have a look at the vascularization of the spleen, maybe we could just make the stomach disappear, and you can see how the spleen receives its blood supply. So it's basically coming by the splenic artery, which is a tortuous artery. It's a branch of the celiac trunk. Let's make the pancreas disappear so you can have a closer look at the splenic vein, which eventually joins the inferior mesenteric vein and further the superior mesenteric vein to form the portal vein. There you go. Can you see that? Okay. So I hope that gives you a basic idea about a few things when it comes to relations and morphology. Let's go back to the PowerPoint presentation. Okay, now please note that the histology and the embryology will be dealt in a separate section. So we're directly going to move ahead to the clinical anatomy of the spleen. Palpation of the spleen. The normal spleen is not palpable, however, it can be mapped out by percussion. Now, when it is enlarged more than double of its size, it becomes palpable at the left costal margin during deep inspiration. Splenomegaly. We already spoke a little bit about it. It occurs in a number of diseases. In certain diseases, it may increase tenfold. The common causes here are malaria, kala azar, cirrhosis of liver, and chronic myeloid leukemia. You will see that when the spleen enlarges, it projects downwards and medially towards the right iliac fossa in the direction of the axis of the 10th rib. Hypersplenism. Not to be confused with splenomegaly, hypersplenism is a condition where the spleen is hyperactive, which means there will be increased destructions of RBCs, and splenomegaly would be one of the clinical signs due to that. Splenectomy, that is the surgical removal of the spleen, is performed in the treatment of certain blood diseases. You would also see, while studying embryology, something known as spleneculi, which are small accessory spleens. In fact, some authors say that the splenic notches are actually indicating the lobulated development of the organ. Splenic rupture. Now, this can usually be happening due to severe blow to the left side of the abdomen. And what it leads to is pain on the left shoulder. Now, this is due to irritation of the left cupola of the diaphragm because of the collection of the blood over there, and the left phrenic nerve, which innervates this region, also innervates the cutaneous area of the left shoulder. So it's essentially referred pain. Also note that the spleen has an avascular plane. So when you're operating on the spleen, you should go along this avascular plane. It is seen as a plane perpendicular to the long axis of the spleen, dividing it into a superior and inferior segment. Alright, I hope you enjoyed the lecture. Thank you so much for listening, and I'll see you in the next one. Also, check out these cartoons. It's called The Awkward Yeti. He makes these really cool cartoons on organs, the basis of which is heart and brain. Thank you once again. Bye-bye.